Now at 7, changes are coming after a Metro Atlanta city says slow ambulances are putting lives at risk.
It's why Brookhaven leaders plan to ditch DeKalb County's EMS provider. Atlanta News First investigator Sierra Cummings live at Brookhaven City Hall. Sierra, the county says it has a solution to the dangerous delays.
That's right. The county and its ambulance company agreed to stricter terms. This after our year-long investigation revealed EMS repeatedly failed to meet mandated response times, sometimes taking nearly half an hour to respond to life-threatening calls.
A series of Atlanta News First investigations showing lives on the line.
Hang tight, hang in there, okay?
As delayed ambulances left Brookhaven families waiting.
Okay, we're here to help you, okay?
County records confirmed in the previous 4 years, response time from DeKalb's ambulance provider, American Medical Response, or AMR, climbed from 16 minutes in 2020 to 21 minutes in 2024 for life-threatening calls. It's why the city of Brookhaven sought state permission to run its own ambulances, because under Georgia law, DeKalb is in charge of EMS for all its cities. After months of review, the state declined Brookhaven's request, instead mandating DeKalb County create an improvement plan. The results? This new operation project proposal, a brand new concept that would break up DeKalb into 3 coverage zones: north, central, and south. During peak daytime hours, have 34 total ambulances in service, specifically 8 in the north, 12 in central, 14 in the south. Then, during peak overnight hours, 27 total ambulances in service. That's 5 in the north, 10 in central, 12 in south. Plus, a new contract between DeKalb and its provider, AMR. The mandated response time for life-threatening calls drops from 12 minutes to 11 minutes. And AMR will now be subject to emergent versus non-emergent performance reviews, meaning routine analysis on how quickly they show up to something deadly like a shooting versus a car crash with minor injuries. The company faces increased fines for certain delays, changes that could save lives.
All right, so at the state level, if AMR fails to meet these terms, they could face hundreds of thousands of dollars in fines. But at the state level, if this plan does not work out, the state agency which oversees ambulances, the Georgia Department of Public Health, can give cities like Brookhaven permission to fire DeKalb County's EMS provider and run its own ambulances. So it's something we'll be watching. This plan is in place. It's supposed to have some kind of improvement by July of this year. We'll stay on it. We're live in Brookhaven. Sierra Cummings, Atlanta News First investigates.